Hello, welcome to this episode. In this episode, we'll be talking about hypertension. My name is Dr. Ahmed Abdulrahman, and in this channel, as stated earlier on from the other episode, we're talking about common medical conditions. So today, we talk about hypertension. So let's dive into the topic. What is hypertension? Hypertension has been defined by different associations across the world. The American College of Cardiology, American Heart Association guidelines, they define hypertension as adults with blood pressure above 130 millimeters of mercury for systolic and 80 millimeters of mercury for diastolic. However, according to the Joint National Committee, the 8th edition, they define hypertension as BPs or blood pressures above 140 over 90 millimeters of mercury. Okay, so in this discussion, our reference point is going to be on the Joint National Committee, that is JNC8. Okay, so anytime I mention hypertension, I'm referring to blood pressures above 140 90. Okay, hypertension can be classified into two main categories. Okay, we have primary hypertension and then secondary hypertension. When we say primary hypertension, we are talking about hypertension that has no cause. Usually, they have no cause. We can't identify any particular thing that is causing the hypertension, and that forms majority of cases. About 90% of hypertension is primary. Okay, some people call it essential hypertension. The other category, we call it secondary hypertension. That forms about 10%. It usually has an underlying condition that is causing the hypertension, typically of renal origin. It could be endocrine, that is from the hormones, or from the vascular system, that's the blood vessels. Okay, now let's move on to the signs and symptoms of hypertension. Clinically, hypertension is usually asymptomatic. And when we say asymptomatic, we are saying that hypertension usually will not give you any symptom. Okay, but when it does occurs, usually have symptoms such as headache, dizziness, chest discomfort, or tinnitus in the ear. Okay, another case is when hypertension is asymptomatic in an individual. One way it will manifest is when it has already damaged an organ. And some of the organs that are usually damaged are the brain, the heart, the kidneys, and or even the eyes. Okay, so the brain, you can have stroke or even transient ischemic stroke. You can have heart, like a heart condition, heart failure. You can have hypertensive nephropathy, that is kidney injury. Okay, and you can have uh, retinopathy, that is in the eyes. Okay, so these are the common manifestations of hypertension. Okay, so our main focus in this episode is going to be on the risk factors. Who are those at risk of getting hypertension? One, we have the aged. The aged are at high risk of hypertension. Another group is people who are obese. Okay, they also have higher risk of hypertension. People who have high lipids in their body. Okay, that is clinically we say hyperlipidemia or dyslipidemias. They are at high risk of getting hypertension. Okay, another category is pregnant women. Some pregnant women may develop hypertension. We say pregnancy induced hypertension. Okay, so these are some of the risk factors associated with getting hypertension. Okay, so how do you diagnose somebody of hypertension? As the ordinary man on the street, how does the doctor come to a conclusion that you have hypertension? Okay. Usually, when you go to the hospital and they take your blood pressure, at the first time they notice that it is high, we say you have a high blood pressure. However, we cannot say you have hypertension because not every high blood pressure translates into hypertension. Okay. So when you come to the clinic, usually we take your blood pressure. If it is high, we will continuously monitor it. Okay. That is, we will let you go. That is, if it's not too high, such that you are already having the end organ damages, we will let you go, and we give you a monitoring chart. You record your BP at home and bring it back for review. And on the review, the doctor will now interpret the values of your BP recordings and then conclude whether you are hypertensive or not. Then you put you on medications. Okay. Another way of checking for or diagnosing hypertension is to check for end organ damage. Okay. So when you come and you have a recording of high blood pressure and you are not a known hypertensive, we can do certain tests such as renal function test that test your kidneys to see if that high blood pressure has already caused some damage to it. Okay. If it has, then we can say that that high blood pressure has been there for long, and so you are hypertensive, and we will need to initiate treatment as soon as possible. Okay. So how do we manage hypertension? This is also another key interest point. Okay. Hypertension, for treatment of primary hypertension, as I mentioned earlier on, it includes simply modifying your lifestyle. Okay. So you have to modify your diet. You shouldn't eat a lot of red meat, not eating a lot of carbohydrate, especially at night before bed. You have to eat early as well, okay, so that you will not accumulate a lot of fat in your blood or in your blood vessels. Another thing is, if you are obese, you have to try and lose weight, okay? You have to lose weight. This will help to reduce your blood pressure. The next thing is exercise. You have to regularize exercise at least 3 to 4 times in a week, okay? 3 to 4 times in a week you exercise. It will help to burn down the fats in your body and then improve circulation, and then you notice a drop in your blood pressure. Okay. Now, some of the dietary recommendations I'll give you is to eat more fruits. Okay. Fruits, you can also eat more vegetables. Okay. And then vegetables, we have the tomatoes, carrots, and all those you can find in the market depending on where you are coming from. Okay. Fruits, you have mangoes, you have oranges, and all the other fruits you can get around you. Okay. Try and make good use of them. Another thing is taking low fat dairy foods. Okay. You have to ensure that the foods you are taking, especially those you buy from the supermarket, those you buy from the streets, you have to read the labels and make sure that they have low fats. Preferably it should be less than 1%. Okay. You have to cut back on food that are high in saturated fats. Okay. Food that are high in cholesterol and trans fats. Okay, these are usually indicated on the processed foods that you buy. So you have to read the labels and then make use of them. Okay, foods that contain these fats, try not to use them. Okay, and you have to encourage the eating of whole grain foods. Okay, and then fish rather than red meat. You should eat more fish. Okay, and then nuts. And you have to also limit the intake of salt. Cut down the intake of salt. Do not put extra salt in your food, in your soup, and every other thing that you need. Not only that, even foods you buy from outside, you have to look at it. Okay? Reduce the intake of sugary drinks, okay, such as the high energy drinks that are around. Cut down the intake of them, as this will help you to control your blood pressure, and also reduce the intake of red meat, as I mentioned earlier on. Now let's go to the pharmacological treatment. Usually, your doctor will prescribe some antihypertensives for you to take. Now, these antihypertensives are in different categories and are tolerated by people differently. So, if your doctor prescribes an antihypertensive for you and you experience certain side effects that are not tolerable, you have to go back to your doctor and then he'll change your antihypertensives for you. You don't have to abort taking the antihypertensives, as this is detrimental to your own health. Okay, this is a common thing that we find among our patients. Okay, so there are special group of people whom I will not be talking too much about, and that is pregnant women, hypertension in pregnant women, and then the children. Yes, children can also get hypertension, especially, but it's in rare cases. Okay, pregnant women and children for their hypertension demands certain special management, because the usual drugs that we use to manage the hypertension are usually contraindicated for them. So I'll recommend every pregnant woman who has a higher blood pressure, every child who is being diagnosed of hypertension, to see a specialist for appropriate management. Okay. Now I'll leave you with some myths about hypertension. Okay. I'm giving you some myths about hypertension and what the facts are. Okay. The first myth is when somebody says my blood pressure is over 140/90, but I don't think I'm hypertensive. Okay. But you have to notice that high blood pressure doesn't necessarily translate into hypertension. However, if it persists, okay, if it persists, you have to see a doctor for appropriate management to be taken. Some people also record blood pressures that has one parameter higher than the normal and the other being normal. So let's say somebody has a systolic blood pressure that is high, but the diastolic is normal. Okay, and they get confused. They don't know whether they are hypertensive or they are normotensive. Okay, the fact is that all the parameters are very important, both the systolic and the diastolic. They are very important. So when you see derangement in any of them and it persists, you have to seek a medical advice to address that condition. Okay, another myth is the signs of blood pressure are obvious. Okay, the fact is that high blood pressure has no symptoms. Okay, as I mentioned on, if it does come, the symptoms are vague. It could be any condition. Okay, another myth is as long as I don't add too much salt to my food, I can eat what I want. That is not true. Okay, it's not just the table salt that you put in your food that you need to worry about. You need to worry about every other food that you buy or you eat. Okay, that contains salt. Some people also have a myth that drinking coffee can cause an increase in my blood pressure. That is not true. That is not true. Coffee doesn't increase your blood pressure. A lot of literatures does not support this. Okay. However, taking alcohol can increase your blood pressure. And this I forgot to mention. In managing your blood pressure, if you are also an alcoholic or you take alcohol or you drink, you have to avoid taking those things. You have to avoid taking those things, as this will worsen your condition. Okay, another myth is high blood pressure is more common in men. The fact is that high blood pressure depends on the age. Okay, high blood pressure is common in men of all ages less than 60 years. However, for people with age more than 60 years, the prevalence of high blood hypertension increase in female. Okay, So the hypertension is more common in female of ages more than 60 years, but it's more common in men for ages less than 60 years. Okay. Another one is the risk of blood pressure is the same for people of all races. It's not true. Black adults have an increased risk of developing high blood pressure. Okay. And other people hold the myth that I don't need to worry about blood pressure if I am young. That is not true. Okay. Although hypertension does not affect, it does affect older people. Young people can also have it too. Okay. So you need to be worried about it and do a regular checkup. Another myth is there is nothing I can do to prevent high blood pressure if it runs in my family. Yes, you can do something. Even if you have the risk factor of having a first degree relative who is being hypertensive, okay, you can still modify your lifestyle, such as the diet, the exercise, cutting alcohol, stop smoking, then you will not get it. You may not get it, even though you have a risk factor, a positive family history of hypertension. Okay. Some people also hold the opinion that as long as they are on their medication, they don't need to do any other thing, okay, to reduce the blood pressure. That is not true. Managing hypertension is a holistic thing, and whilst you are on your medication, you don't need to stop your exercises. Okay, you still have to do your exercise, modify your diet, and then uh, continue the healthy lifestyle habits that you used to perform. Okay. Some people also hold the myth that, and this is the last myth I'm going to give you for this episode. Okay. Some people hold the myth that if their blood pressure comes down while they are on their medication, they can stop the medication. Please, this is not true. You should always continue your antihypertensive even if your blood pressure normalizes after starting them. Okay, this is very key. Okay, so this brings us to the end of this episode. In our next episode, we'll be talking more and more about diabetes. Okay, what diabetes is, what are the risk factors, and what we should do when we are diagnosed of hypertension, what foods we should eat, and what foods we should avoid. Do subscribe, share,